Hi, my name is Bennett Kincaid, and for my project, I decided to look into what are the impacts of mental health on physical health, as well as what we can do about it. I already tried to record this two or three times. I had a few technical difficulties, and I also was rambling a little bit much, so I may do that occasionally. And I will already kind of preface this with the fact that I will be relating a lot of this research to my own personal experiences because I personally do have mental health issues. But regardless of that, I'll get started. So, for the main topics of discussion, I wanted to research this in general because, like I said, I have my own mental health issues. I've had anxiety and depression for many years. I take medicine for it, I get help for it personally, and I've seen in my own self and in my own health that my physical health has gone down many times in the past few years because of my mental health being extremely bad. The first example for me was COVID. I gained a lot of weight. I've had stomach issues, pretty much everything that you can think of that comes with mental health. So I wanted to look into that. And that goes right into what the main topics of discussion are, is the fact that mental health is usually under researched and underutilized in terms of the healthcare system in the United States. It's a very prevalent thing, especially since COVID. There have been a lot of research is done, studies, and more people have started to come out with their experiences with their own mental health issues regarding what it has done to their own mental health and the fact that they have been having issues as well as their physical health. And I just wanted to go into this to talk about how bad the problem really has gotten and how we can really fix it, and also looking at the numbers itself to view where these problems occur, how they start, and how often they happen. So, for the first source, I wanted to look into No Health Without Mental Health. It was a really, really good study and article that showed a lot of statistics regarding uh, death rates, specific statistics of how often that this is occurring in people nowadays. And I don't exactly want to read word for word off of all of these. I kind of just want to go and explain it in my own way. But to read some of the statistics that I found very interesting in regards to the topic that I'm researching, about 14% of the global burden of disease has been attributed to neuropsychiatric disorders. Now, this can include a wide array of mental health disorders, but for the general amount of things, it does affect a lot of people, and it has started to rise. Going down further, every year about 800,000 people commit suicide, 86% of whom are in low income and middle income countries, and who are in between the ages of 15 and 44. This point I wanted to bring up, and why I put it in the presentation, is because this is how things usually start for people who have a lot of mental health issues. Um, I mean, in my personal situation, I started to have really bad mental health during COVID because, like most people, or many people in the United States, around the world, money was kind of hard to come by for a while. I was struggling to pay rent in the city with how expensive everything was just to buy myself groceries. I had to pay off my car. I have a dog, which I have to pay for appointments, food, a lot of things that many other people can relate to. And if you're in a low income household, if you don't have a very high paying job, or if you're not making enough money for yourself, it can definitely add on to a lot of stress that will affect your overall health, which goes into the whole point of the presentation. Now, something else that I can relate to, which goes down to the last bullet point, is that often when you do suffer from a mental disorder, um, it can be embarrassing and it can be delayed to go ask for help, to go to a psychiatrist, to go to your doctor, to talk to your family, your friends. It can be a very embarrassing thing, and it's hard to talk about because you are almost contemplating what is going on in your head. Are you the reason why this is happening? Is this normal? Is it not normal? There are a million different things that can come about, and oftentimes this can lead to putting you into risk factors, like I mentioned, such as smoking, which I personally experienced, and I realized that that was putting me down a lot. Reduced activity, not working out, not going outside, walking, doing anything really, a poor diet, obesity, among other things. But overall, this source was really good for finding some really good statistics. I had another, but this one was definitely one of the better ones of the three. Now, for the second one, this came down to just more explanations and explaining why things happen the way they do. The article, as you can see, is the relationship between physical and mental health and mediation analysis. So, one of the things that I found interesting by this is the fact that past experiences can have a direct and indirect impact on your overall health. A lot of people go through traumatizing experiences, whether it be something minor or major, whether it be a family member passing away, somebody getting sick, losing a significant other. There are a ton of different examples that can come from this, but it can have a really large effect on your overall health over time because you're not addressing it, which goes back to the issue I mentioned in the last slide about delaying to go seek help. Seeking help is extremely important in this, and if you don't address the problems that you had in the past, there's no real way to move on from them and to move forward and kind of leave it in the past and try to work on what you have going for yourself now. And in correlation with that as well, social interactions are critical production factors in health. Uh, this goes back into the fact that usually when you are suffering from mental health issues, you don't want to go outside. You don't really want to be active, and that doesn't involve just going on a walk or doing anything like that. Going to the gym, it involves like seeing your friends, seeing your family, being social, and getting out there and being more outgoing with yourself, and not putting yourself in a little box that forces you to think about every problem that you have. Because when you do that, oftentimes you're stuck going in with the other bullet point at the top is that you have a lack of sleep or you have stress about other things. And I mean, I experienced myself. There were many times that even now, if I get too stressed out, which has happened throughout the quarter here at DePaul, I find myself thinking about so many things that it's hard to fall asleep. And then when I can't fall asleep, I get a lack of sleep because I still have to get up for class. I still have to get up to go to work. I still have to get up to walk my dog or do the simple things I have to do in my day. And when that starts to stack up, it can really have a huge effect on your overall health. So it's definitely something to address that overall past problems need to be addressed or else it can have an effect on you. Lack of sleep, all of those things can have an effect, so it's important to watch all the different factors. Going back onto the last source, bridging the gap between mental and physical health, a multidisciplinary approach. This goes more into, again, more of the things that can cause you to have problems or things that can lead you into it. So the biggest thing I wanted to get from this is to look at all the possibilities of what could possibly happen to you and to see how much of a problem that could pose for people. So from what I found, people who do struggle with mental illnesses are much more prone to engage in a lot of unhealthy lifestyle practices. And these aren't the only ones that are out there, but these are definitely the most prevalent and important in my opinion. A lack of physical activity, poor nutrition, overeating or undereating causing weight loss or weight gain, smoking and substance abuse, which can lead from people going to cigarettes, alcohol, hard drugs, anything that can really, for them, make them feel like they're fixing the problem, even though it's only a temporary solution. It's actually making things much, much worse. And then I also wanted to look at the broader perspective of how many people do deal with this problem. And what I found in this study slash article was that 1 in 17 adults suffer from serious mental health care. I mean, serious mental illness. And it goes back into a point I stated earlier about how 1 in 17 adults suffer from mental illness. And if there are that many people that do suffer with this, and it's already something that is medically underserved and with substandard care, it can create a huge problem for these people to actually get help, and it can prolong the whole process. Because an example that I wanted to make with this is that when you go in for a physical health problem, say you go into the doctor because you broke your arm or you broke your leg, whatever the case may be, they can review it, they can look at it physically, and they can come up with a solution. And at that point, they have a solution for you, and in a few weeks, a few months, whatever the case may be, you're done, you're good to go, you just have to do what you have to do, and you're done. But when it comes to mental health, it's not something that can really be seen very obviously, especially at the beginning of the process of someone struggling, because it is mental, it isn't physical. So a lot of times it's hard to find out what is going on with people, how this is all happening, and how they should treat it. So it's definitely something that needs to be looked into, and that from a view of community psychology, that communities need to be more engaged with having the resources to be able to go and talk about these things, and having not only the resources but the right ones in terms of having high quality care, not something where you go into the doctor and you say, okay, I'm having anxiety, I'm having depression, I'm having whatever symptom it might be that leads into a mental disorder. And it needs to be properly handled and not just thrown under the rug or pushed on to say, oh, maybe try this, that, or whatever it may be. It needs to be taken seriously, and it needs to be done the right way. Because if not, as seen in the slide, the population of those who do have mental disorders lose from 13 to 20 years of their life compared to those who do not, which is an incredible disparity. And on top of this, obviously, people with serious mental illnesses have higher rates of morbidity and premature mortality compared to the general population, which again goes into the entire problem of how this needs to be figured out quickly, because if it doesn't, then it'll take a long time to figure out things. And that's just more time that people are losing to overall stress, their body deteriorating. Um, it can cause a massive chain reaction for a lot of problems. So, going into the overall findings and the overall significance, I already kind of ran through everything, but I decided to put this infographic in because it is significant in my opinion, because it's something that I personally try to follow. I personally go to Advocate Health. It isn't the exact branch that is being advertised, but this is something that they always try to tell me when I go in for my issues, is that getting proper sleep is incredibly important because it's giving your body and your mind time to heal if you are going through something. And when you do wake up and you have the proper sleep, you feel much better. Your mind is in the right place. If you're not getting any sleep all the time, it's awful for your head, for your mental space, every part of it. You need to get up and you need to be active every day. You have to eat well. You can't just occupy yourself sitting in what is now a modern age problem with my age group is being stuck on their phones, on social media, on TikTok, on Netflix, YouTube, everything. You have to make sure that you space out your day so that you're doing things that are productive and not things that are putting yourself in a bad habit to put you in a place where it could lead you to feel those feelings of mental illness that you do not want to hear or feel. And going back to this, well, the findings in general. So back to what I already stated, it has shown that if you do take better care of your mental health, your physical health will improve if you're already in a bad state. So it's not like you're a lost cause, and it also goes backwards to the fact that if you don't take care of it, it will get worse, like I've stated. So it's important to stay away from bad lifestyle habits, staying away from health issues that could hurt you, and it's important to advocate a lot for adequate care. And I mean, I know we use the example, I talked about it in a lot of discussion posts, and I'll get into it in a second. I just want to get to the next slide because that's more pertinent for what it is. So for this reminds me of, I can't remember the exact name or what week it was in. It was semi-recent, maybe a few weeks ago. But we looked into this place in Pittsburgh where these communities didn't have access to healthcare. They had to drive almost 40 minutes to get to a hospital. There weren't very many stores. It was just hard for those people to live. And this isn't just a problem with these things. It's a problem for health and mental health and things that need to be done as a community in all different parts of the country. Because I'm sure, I mean, in Chicago, there are hundreds of different places that you can go to go and find and get the adequate mental health care, but it's not like this is just a Chicago problem. It's a nationwide problem. It's a worldwide problem where in the United States, even if you live in a small town somewhere in Arkansas or Indiana, where I'm from, I mean, I know personally, I live in northern Indiana, which is one of the more populated areas, and even in South Bend, it can take weeks or months just to get one single appointment, just to go in and see if you can talk to somebody. Now, if you want to keep going and you want to go and figure out more, then you're going to have to wait another few weeks, another few months, because everything is so backed up because there's not enough resources for people out there. So I would say that from a community psychology standpoint, that's definitely one thing that needs to be improved. It needs to be fixed. There needs to be more areas for people to be able to go and get some help. It can't just be putting all of the places that you can go to into some massive cities or majorly populated areas. It needs to be spread out, and it needs to be fair, and it needs to make it so that any person from any neighborhood has the ability to go get help, and it makes sure that it's adequate. On top of that, in terms of ways that we can help, other than advocating from a community psychology standpoint, I would say is just to reach out to your friends, loved ones, anyone that you know, and make sure that everybody's doing well. I mean, it doesn't hurt to send someone a quick text or a call that you haven't talked to in a while, ask how they're doing, if they're good. And it also goes to the fact that people need to learn to be able to speak up more. And I think that that's beginning to happen uh, more in the past few years, like I stated. But um, it is kind of overstated, but it still doesn't happen enough that people need to be able to check on each other and make sure that everybody are doing all right, because you never really know what people could be going through. Um, I also firmly believe that if you do feel like someone is not doing well, it's only proper to reach out to their family, to their other close friends, siblings, anything like that, to make sure that they do get the proper help that they need, because you never really know in what situation it could be. Because, I mean, it's a very cliche but true thing, is that often the people that are laughing the most, smiling the most, are often the people that are struggling the most because they're trying to put on a face. So it's something to keep in mind and something that we can do to help. And in addition to what the infographic I have right here is, I think that these bring up a number of good things we can do. Is, like I said, listen to and support others, share stories of overcoming your issues, how you get through it, help each other out. It shouldn't be a one person struggle. Everybody should be able to help everybody. Educate people overall about mental health, the symptoms, everything like that, so people do understand when they aren't doing well and they don't have to guess and go and wait weeks or months to get an appointment just to find out whether or not something's going on. It should be something that should be recognizable. And going on to charities, the National Alliance of Mental Health and Illness, excuse me, Fountain House, Project Heal, and Active Minds. I personally like Active Minds the best. They're obviously all incredible charities to go to. They're all doing the right thing, but Active Minds is one that definitely advocates a lot on social media that I can see personally all the time, whether it's posting infographics, posting things to help people that are getting through their days. They're a very good charity, and I feel like if there was any way to help, it would be through any one of these charities or advocating. And I mean, in our case in Chicago, maybe to your local alderman, um, mayor, anything like that. I mean, it could even go as far as creating a massive group to send things to Congress to ensure that mental health resources are being reached out and that people understand what is really going on. Um, for the general amount of the presentation, I would say that is everything I do have to say regarding it. I'm pretty sure I did cover everything. These are my three sources, and I hope I didn't ramble on too much about things. I know I may have repeated a few things here and there, but I guess it was just to make my point, and also because there were similar points within each of the sources. But I tried to do my best in addressing everything in a clean and concise way. So thank you.